a presentation for healthcare professionals on breathlessness management during COVID-19. Welcome, my name is Emma. I am a senior physiotherapist specialising in palliative care at Birmingham St Mary's Hospice. Normally my duties at work include running a breathlessness clinic, leading a day hospice service for patients with life-limiting conditions, and working in St Mary's inpatient unit supporting patients to manage symptoms such as pain, fatigue, reduced mobility, breathlessness and respiratory symptoms. My aim today is to share with you as healthcare professionals some of my knowledge and learning scoped from recent guidelines produced to support the management of some symptoms that may be prevalent from suspicion through to the end of life in coronavirus cases. Throughout this presentation, we are going to focus on cough, how to reduce fatigue and maximise comfort, breathlessness, how to manage these symptoms without medications, and the benefits of a person's position in managing both of these symptoms. Please do be aware that as we are facing unprecedented conditions, guidance and policies may change, and it is all of our responsibility to remain up to date with advice. However, the majority of this content is extrapolated from existing evidence in the non-pharmacological management of respiratory symptoms. Coughing is now a common symptom of the coronavirus. It also increases the risk of cross-transmission. It remains best practice to continue to cover the nose and mouth with a disposable tissue and immediately put into a closed bin. Cleaning hands with soap and water, wipes or alcohol gel should be encouraged after coughing, as well as after sneezing or blowing their nose. To support the management of a cough, the position of a person can help dramatically. For comfort overnight, they may benefit from slight elevation or supported sitting in a more upright position. During times of wakefulness and coughing, they may benefit from regular repositioning, in addition to holding a small pillow or cushion across their stomach to support their cough and reduce fatigue in their abdominal muscles. It may also be beneficial to encourage fluids for hydration. If they are able, you could consider honey and lemon in warm water. Smoking should be avoided by the person, in addition to those around them, to reduce the severity of their symptoms when coughing. Active cycle of breathing is a technique to support secretion clearance, already used in chronic lung conditions. It aims to reduce the need to cough throughout the day and reduce feelings of breathlessness. This cycle can make the cough more effective, meaning that the amount of coughing can be limited. It is important to get into a position that is comfortable, either sat upright or in a side-lying position. Start the cycle by trying to gain control over your breathing. At a comfortable pace, breathe in through your nose and breathe out through your mouth. At this stage, try to soften your shoulders, and you should feel your stomach gently moving with your breath. This stage may take a couple of minutes. Then, move on to deep breathing. Here the aim is to expand your thoracic space, to improve air entry into your lungs and loosen secretions. Take a long inhalation through your nose. Hold your breath and breathe out through your mouth at a comfortable pace. Then slowly repeat this 3 to 5 times. The final stage of the cycle is commonly known as a huff. This is a forced expiration and is designed to move the secretions higher, enabling them to become easier to clear. Take a slow breath in through your nose. Open your mouth and huff the air out, as if you are trying to steam up a mirror. You should only huff once or twice per cycle to avoid fatigue or becoming wheezy. You can then repeat the cycle as needed. Some people may benefit from one cycle, others will feel the benefits after some repetitions. Remember to take your time over each stage and each cycle. Do not try to carry on for longer than approximately 10 minutes. Where possible, try to make the active cycle of breathing as effective as possible by completing after use of nebulizers or when in a good position after movement, for example after walking or repositioning in bed. Breathlessness can be normal. It is a natural response when we exert ourselves. However, some conditions, including COVID-19, can cause shortness of breath or breathing discomfort during very little physical activity and towards the end of life. Breathlessness can present in a number of ways. You may feel hot, dizzy, lightheaded, sweaty, nauseous. You may feel anxious, panicked, overwhelmed and fatigued. Although breathlessness is a subjective sensation, when assessing you can use objective measures such as respiratory rate, breathing pattern, use of accessory muscles, evidence of cyanosis, and difficulty in completing sentences when talking. Positioning can greatly support the management of breathlessness. Should the person be able to sit in a chair or stand up, they may benefit from leaning forward over a window ledge or kitchen side, or when sitting, leaning forward with elbows onto thighs. These positions can be adapted to manage symptoms in a person needing more support or in a dying person. When sitting or in bed, pillows can be used on a table to allow the person to lean forwards in comfort. Otherwise, side lying can be adapted with pillows under the head, supporting their stomach and arms, and in between knees and ankles. Towards the end of life, the person is likely to experience more and more difficulties in everyday activities and spend more time in bed. This can be a sign of their deterioration. During this time, the person will benefit from support in keeping clean in bed, support from carers both formal and informal in washing and maintaining good hygiene. In order to protect the person's skin from pressure damage, they will also benefit from regular repositioning. This may be a change from lying on their back to lying on their left or right side every 2 to 4 hours. During washing and repositioning, it is a good opportunity to check their skin for changes in appearance or colour. Where possible, pay particular attention to the back of their head, shoulder blades, elbows, bottom of their spine, hips, buttocks and heels. Before starting any technique to manage breathlessness, ensure the person is in a comfortable position, either leaning forward or adapted in chair or bed with pillows. Consider the temperature in the room. High temperatures or a feeling of warmth is likely to aggravate breathlessness. Therefore, please consider opening a window to provide fresh air and cool the temperature of the room. Fans are commonly used to reduce the sensation of breathlessness in chronic respiratory conditions. However, due to the risk of further infection, they are not recommended for use during suspected or confirmed cases of the coronavirus. Therefore, an open window or a cool flannel on their face can provide similar benefits to fan therapy. Encourage both controlled and deep breathing techniques, demonstrated earlier in the active cycle of breathing, to reduce breathlessness. Controlled breathing includes breathing at a comfortable pace, inhaling in through the nose and out through the mouth. Deeper breathing should include a similar technique with an increased length of inhalation and exhalation, and where possible with a pause after each. It can help to imagine a rectangle. As you breathe in, imagine or even trace your finger on the top long side of a rectangle. Hold for the short side and exhale on the next long side and pause again. It can also help you to count as you go to pace yourself. Remember, lengths of inhalation and exhalation can vary between different people. There are many different ways to try and relax. try initially to create a peaceful environment. Keep a consistent level of noise and aim for calming sounds. Some people may relax by imagining themselves in their favourite place. Others may enjoy soothing music. And others will benefit from listening to relaxation scripts or audio to promote a feeling of relaxation. Reassurance is key to the non-pharmacological management for breathlessness. It may therefore be beneficial for the carer to participate in the techniques and relaxation in order to support each other as a unit. In the final stages of life, breathing patterns may change. Breathing may become shallower, and there may be long periods of long pauses between the breaths, known as apnea. At times, the dying person can experience breathlessness. This can be exacerbated by anxiety, and so often it is best to provide comfort and calm reassurance by simply being present with them. It can be helpful to ensure they are in a comfortable position, perhaps lying on their side and supported with pillows. Where possible, an open window will provide cool air to help relieve some of the breathlessness. At times, breathing may also become noisier. These are the normal fluids in our mouth, throat and lungs producing a rattling sound. Although these sounds can be worrying to hear, they do not appear to cause distress to the dying person. I hope that you find this information useful in providing patient care at different points in their journey with the coronavirus symptoms. Thank you for your time.